After 3 short visits, I came out with this great eye, and it's easy to use, great to put in, take out, and it looks just the way my eye did before I lost it.
And, you know, being involved in a lot of things, I think people just accepted me for the way I was. And a lot of people didn't even know I had an artificial eye.
Annie looked at herself in the mirror and just was overcome with joy. It was just a wonderful moment as a parent to experience that.
This video was produced to help people who are in the process of receiving an artificial eye or ocular prosthetic. It is important for you to understand the procedures involved, as well as what to expect over the next few weeks. Initially, you may be feeling a little anxious about the process of receiving an artificial eye. It is beneficial to know that in the United States alone, thousands of people received artificial eyes in just the last year. That includes doctors, lawyers, teachers, athletes, all ages of people in all walks of life. In the vast majority of these cases, the patients continued their lives and careers without skipping a beat. These people were feeling much as you do right now, and yet their lives have changed remarkably little since receiving their new eye.
With my type of business and being the owner here, you know, I'm involved in all aspects, and so like we do a lot of our own remodeling and things like that. I work with power tools. I always wear safety glasses. My judgment as far as depth goes has been something that I think I've learned to use the devices that you see in everyday life, and so I really don't have a problem with depth perception. Hunting, for instance, I was right-handed, now I have to shoot left-handed, although I'm not a hunter, but I like target shooting and things like that. Even bow hunting, you know, I can do the opposite way and stuff like that.
Annie is 11 years old, almost soon to be 12. She is a very vivacious, outgoing, enchanting child. She's also very stubborn. She wants to do things her own way. Several years ago, when she first got this new prosthesis, was the center of her universe. Everything revolved around her appearance, how she looked, and how this eye changed her life and how she wanted to be. I can't think of anything that Annie doesn't do that any other child doesn't do. The eye is not an issue at all in terms of fit, in terms of it falling out, breaking, any discomfort. She can hang upside down on the jungle gym and it doesn't dislocate. There's very little care involved with it. At age 11, she's doing all the care of it herself.
When I first came to the office, I was a little bit afraid. I didn't know what the process involved, and I thought it was going to be very, very painful. After speaking with my ocularist, I was really at ease, and it seemed like a great procedure and was going to be just a very short process, and I would have a beautiful eye. The impression portion of the visit was the part that I was very nervous about. I thought it was going to be very painful. I didn't understand what was involved, but once I sat in the chair and had the little thing put in, the whole process was very pain-free. Now that I've had it in, it's so comfortable I don't even really notice it's there.
Before talking about the steps involved in receiving an artificial eye, keep in mind that there is a tremendous amount of variation from one patient to the next and from one ocularist to the next. Because of these differences, it is important to follow the instructions of your ocularist concerning your particular case. There are very few standard artificial eye fittings. But don't worry, your ocularist has had years of training to ensure you the finest care possible. Your ophthalmologist will refer you to an ocularist about 4 to 8 weeks after the surgery. A written prescription for your artificial eye will be placed by the ophthalmologist, who will then work with the ocularist to clarify any special instructions concerning your case. It's a good idea to get a copy of the prescription for your own records for filing a claim with your insurance company. When you arrive at the ocularist's office, you will be asked to fill out some information forms. Be sure to have your medical insurance card available, as well as the doctor's prescription we just discussed. Because all prosthetic work is done on a custom basis, it's important to clarify insurance or payment concerns before any work is started. Once the necessary paperwork is completed, the ocularist will want to review your medical history in detail with emphasis on the circumstances leading to the removal of your eye. He or she will examine your socket for swelling and proper healing before the fitting begins. As you are establishing a good relationship, your ocularist will feel more comfortable with your case, and addressing your particular situation will begin to take shape. There are several methods and variations to the fitting process. Your ocularist will describe their specific method step by step. The most common way to fit an artificial eye is to take an impression. A soft liquid impression material is inserted into the socket or over the remaining globe. Within a few minutes, the impression material sets into a gel which retains the exact size and shape of your socket. Taking an impression in this way usually takes less than 10 minutes. After the ocularist is satisfied with the impression, they will determine the proper pupil location for your artificial eye by matching it with your good eye. The next step is the coloring of the artificial eye. In order for your ocularist to best match your eye color, wear neutral tones such as beige or white. Bright primary colors reflect and bring out tones from your eye that are not always evident. The ocularist may also study your eyes at length in order to properly match the details and patterns of your iris. A pupil size is chosen that most closely matches your pupil size in normal light. The ocularist now combines the completed impression shape with the iris color to create a custom acrylic eye. Further adjustments such as veins and tinting of the white portion of the eye will also be completed at this time. A final coat of acrylic will be applied last, giving the eye a smooth, glossy surface that adds lifelike depth to the overall look of the eye. The entire process takes several hours and may take more than one visit depending on your particular case. The ocularist has now completed the creation of your artificial eye. During the delivery, however, it is not uncommon for the ocularist to make some final adjustments to the eye, usually requiring no more than a day or two. Once you and your ocularist are happy with the fit and appearance of the eye, they will go over care of the eye. Most ocularists agree the less you handle your eye, the less irritation and discharge you will experience. However, hygiene schedules differ from patient to patient. It is important to follow the instructions of your ocularist with regard to cleaning your eye. Unless you are told otherwise, always use the suction device that your ocularist can provide. To remove an artificial eye, gently lift your upper lid to expose the iris of the eye. Squeeze the shaft or stem of the suction cup and firmly press the cup against the iris. Take care to assure even and full contact with the suction cup. It may be helpful to wet the end of the suction device to assist in attachment. Once you feel you have good contact, release your squeeze on the stem without losing contact with the surface of the eye. Next, release your upper lid and gently pull your lower lid down, exposing the rim of your artificial eye. Using the suction cup, gently tilt the eye up so as to lift the lower edge over the lower lid. Once the lower edge has cleared the lower lid, you should be able to slip the artificial eye out by drawing the artificial eye down and out over the lower lid. Once the artificial eye has been removed, flush your socket using the solution your ocularist recommends. You will then clean the artificial eye. It is important to always use a mild cleaning solution on your artificial eye and never use a harsh chemical such as alcohol. Again, your ocularist will recommend a safe cleaning solution for you. Always rinse the surface of the artificial eye well and apply some form of lubricant before attempting to reinsert the eye. To reinsert, squeeze the stem of the suction cup and apply firm pressure over the iris portion of the artificial eye, making sure to get full contact. Then release your squeeze of the stem. Your suction cup should now be attached to the iris of your artificial eye. Identify between the top and bottom of the eye and gently lift your upper lid. Your socket should be exposed and the eye ready to be inserted. Slip the top portion of the artificial eye under the upper lid, moving in an upward motion until contact is made. Without moving the location of the artificial eye, release the upper lid and gently pull the lower lid down and out of the way. Now continue to push the eye back into place. Once you have placed the eye into its proper position, release the lower lid and squeeze the stem of the suction cup to the eye. you may find you will need a few drops of lubricant for comfort. Be sure to keep eyelids clear of any mucus. It is usually recommended that a lubricant or wetting solution be used at least twice daily to assist in comfort and general cosmetics of the artificial eye. The ocularist will recommend a lubricant for you and instruct you on how often it should be used. It is recommended that you see your ocularist at least once a year for a routine polish and checkup. At this time, your eye will be polished to eliminate any buildup that may have accumulated on the eye, as well as any surface scratches. It is also a good time to discuss how the eye is fitting and any other concerns you may have. Let's not forget the care of your remaining eye. Always wear protective eyewear whenever possible. Your physician may even recommend non-prescriptive lenses to protect your remaining good eye. Let's review some commonly asked questions. Will my artificial eye fall out? Any artificial eye can fall out if not properly handled or cared for. Whenever wiping your lids or artificial eye, wipe in a horizontal but slightly upward direction, and always wipe towards the nose. Wiping in a downward and outward direction can cause the lower lid to be displaced and an edge of the artificial eye to slip out. Keeping the eye clean is very important. An artificial eye with surface debris will become sticky and may catch on the underside of the lids. This not only causes an irritation of the lid, but may also cause the eye to become displaced. Will my artificial eye move with my remaining good eye? You can expect movement in your artificial eye relative to how well your implant moves. Your implant has certain muscles attached to it that cause it to move. Movement of your eye will depend on the implant, muscles surrounding it, and the fit of the eye. Your surgeon has selected the implant that best fits your situation to give maximum movement to your artificial eye. Will my artificial eye break? Your artificial eye is made of durable acrylic. This is a big improvement over the old glass eyes, which would break if exposed to extreme temperature changes. However, care should always be taken when handling your acrylic eye to avoid scratching the surfaces or leaving irritating debris. How long will my eye last? Your ophthalmologist or ocularist will be the best person to advise you about when you need a new artificial eye. Generally speaking, you can expect your artificial eye to last 5 to 7 years. However, it may be longer or shorter depending on each individual situation. This schedule does not apply to children who may require more refittings due to natural growth changes. What about sports? You should be able to resume most sports activities. It is always wise to wear protective eyewear in any sport. Water sports are okay too, but it is advised that you wear some type of tight-fitting swimming goggles as an extra precaution. We hope this video has been helpful in answering your questions concerning your artificial eye. The most important thing we want you to remember is to ask your ocularist for help and information whenever you feel it necessary. With your ocularist's help, you can join the thousands of people that have artificial eyes and enjoy full and active lives.